enormous pleasure to welcome Prof. Figel, who is a clinical professor of ophthalmology at the New York University School of Medicine in New York, and he's also the director of the New York Eye Cancer Center and Ocular Tumor Services at the New York Eye and Ear Infirmary. He is the chair of the Ophthalmology Oncology Task Force for the American Joint Committee on Cancer. He wrote the Eye Cancer Staging System section for the Union International for Cancer Control. Also, as the chair, developed consensus eye plaque radiation guidelines for the American Brachytherapy Society, American Association of Physicians in Medicine. Dr. Figel is the founder and chairman of the Eye Cancer Foundation, whose purpose is to develop and encourage international multi-center research on new diagnostic treatments. He has written extensively about new ways to detect and treat retinoblastoma, conjunctival melanoma, squamous carcinoma, metastatic cancer to the eye, and orbital tumors. He has helped produce multiple medical textbooks and chapters on eye cancer, and today, in our ocular oncology masterclass, he will talk us on innovation in brachytherapy for ocular tumors. We are all looking forward to listen his talk. I love the plaque treatments, but I'm looking forward to listen what's the new on brachytherapy then. Paul, we are all here for you.
Hello, my name is Dr. Paul Finger. I'm the founding CEO of Liberty Vision Corporation and an internationally recognized eye cancer specialist. I have spent my career improving methods of radiation therapy for ocular tumors and benign growths. In fact, both the American Brachytherapy Society and the American Association of Physicists in Medicine have tasked me to provide guidelines for ophthalmic plaque radiation therapy. It was my experience treating neovascular age-related macular degeneration with ultra-small eye plaques that led me to start Liberty Vision. As you will see in this presentation, LV has created wonderful tools to provide localized radiation to small areas in the front and the back of the eye. Our radiation source has been cleared for use by the United States Food and Drug Administration. Class 1 and Class 2 medical devices are often cleared by the FDA, which means the manufacturer has demonstrated that their product is substantially equivalent to another marketed device that has FDA clearance or approval. Those already cleared products are called a predicate. To do this, Liberty Vision submitted a pre-market notification submission called a 510K to help in their determination. The FDA considered our new LV device relatively equivalent to the older ophthalmic strontium-90 yttrium-90 device. Therefore, our LV-Y90 disc was cleared for use in the USA. On your left, see the prior strontium-90 yttrium-90 device, which was commonly and widely used for ocular tumors and benign growths in the United States. This old predicate handheld device was used for anterior application and was opaque, metallic, and therefore heavy and relatively inflexible. Though never commercially available, the custom European strontium-90 yttrium-90 radiation disc on your right and its carrier ring allowed the surgeon to sew it to the sclera, primarily beneath ocular tumors. Though the FDA considered our yttrium-90 radiation source to be equivalent to the device on your left, both devices and methods needed improvement. Liberty Vision's designers and engineers took this opportunity to develop applicators that improve disc guidance, positioning on the eye, and radiation safety. Our anterior applicator has built-in shielding, which maximizes radiation safety. Our posterior segment applicator adds guiding lights for localization. Our high-dose yttrium-90 isotope allows for single, quick treatments. It also has a half-life of 64 hours, improving safety in storage and simplifying disposal. Let me introduce our ophthalmic applicators. The I-wand-A was built for anterior ocular use. The shielding module is located at the tip, where radiation shielding is most effective, surrounding the disc source. The I-wand-P doesn't need the shielding module as it sits behind the beta radiation absorbing eye. Plus, the I-wand-P has built-in lights to assist the surgeon moving it into and documenting proper position during treatment. The I-wands are pre-sterilized for single use. Though the FDA has cleared us for 3 sizes, our first LV-Y90 disc is 6 millimeters in diameter. The Y90 is safely encapsulated within its titanium shell. Anterior application is simple. The area of treatment is marked on the eye surface with tissue dye. Then the device is placed according to those markings and held in place for the minute or minutes of treatment. The clear shielding module blocks radiation towards the surgeon and operating room personnel. Liberty Vision replaced the large, awkward acrylic window of the old applicator with a relatively clear, disc-surrounding module of radiation-absorbing plastic, which allows for direct visualization during application. One example of anterior treatment of benign growths is for glaucoma surgery. There exists statistically significant evidence of the efficacy of using the old strontium-90, yttrium-90 applicator to reduce scarring after trabeculectomy surgery. Additional published studies on many hundreds of treated patients are available. However, we have improved delivery by adding shielding behind and lateral to the LV-Y90 disc. By eliminating strontium-90, the use of single-channel yttrium-90 purifies and thus simplifies radiation dose calculations. Y90 is what my engineers call short throw. As you see, the dose is concentrated at the sclera and mostly absorbed within millimeters as it enters the eye. For treatments like trabeculectomy, the lens would be relatively spared. Remember this intraocular dose pattern when we talk about the posterior I-wand applicator, where only millimeters of eye tissue also absorb the radiation and protect the surgeon and operating room personnel. Liberty Vision developed a unique, patented delivery system for the posterior segment of the eye. 4 lights surround the disc. Therefore, once behind the eye, those lights allow the surgeon to guide it to the target and localize it around the growth.
This is an extraocular procedure. The eye is not invaded, which all but eliminates the chance of infection, retinal detachment, and vitrectomy-associated cataract. Our disc-shaped source makes it nearly impossible to miss the target. The only normal tissue to receive higher than a prescription dose is the radiation-resistant outer wall of the eye, the sclera. The least possible dose goes to the raised and thus protectively displaced retina. Our source has been configured to minimize any lateral radiation to the optic nerve. Our source produces a dosage pattern that conforms well with the treatment volume. The radionuclide we have chosen has a rapid drop-off of intensity, limiting the spread of radiation. Finally, we have perimeter guiding lights flanking our source, which visibly glow through the back wall of the eye when viewed through the pupil during the 5-minute exposure. These lights show where the radiation source is positioned, much like rows of lights help pilots know where a runway is at night. Together, these design features augment the delivery of radiation treatment that is accurate, controlled, and conformal.
Like in the movie, this artist's rendering shows the lights when an I-wand-P is placed beneath the macula. Pre-publication clinical images are available. Notice that in the direction of the eye, the Liberty Vision Y90 disc offers rapid, within millimeters, fall-off of dose. Also notice the sharp drop-off to the sides of the disc. This slide shows that the LV-Y90 disc provides targeted treatment with little collateral radiation. This slide demonstrates the relatively rapid 64-hour half-life of yttrium-90. It's no wonder we stripped away the strontium-90 component, which has a half-life of 29 years. Clearly, Liberty Vision's source is environmentally friendly. Some ask, can radiation be used to close neovascularization? As an ocular tumor specialist, I see evidence of that every single day. In fact, every tumor treated with plaque develops a progressive devascularization. On top you see a small choroidal melanoma before palladium-103 ophthalmic plaque brachytherapy. The fluorescein angiogram on the right demonstrates its intrinsic tumor circulation and leakage. On the bottom, 5 years after plaque, the fundus photograph demonstrates tumor regression, and the fluorescein angiogram, if looking at the blue arrows, demonstrates radiation-induced closure of tumor blood vessels. These images are even more dramatic. They're from an older study using a non-commercially available strontium-90 yttrium-90 disc attached to a muscle hook in the treatment of early disciform macular degeneration. What I'm describing today is a single-session, minimally invasive, more definitive treatment. It could reduce the treatment burden for patients, doctors, and healthcare systems. Here is a list of benign growths that have already been treated with beta radiation. They include pterygium, trabeculectomy, fibrovascularization, hemangioma, retinal angioma, PCV, and subretinal neovascularization associated with age-related macular degeneration. However, if you include gamma radiation, this list would even be larger. Other common indications include conjunctival, uveal, and retinal malignancies. At this time, Liberty Vision HDR brachytherapy systems have been used at the New York Eye and Ear Infirmary of Mount Sinai for uveal melanomas and invasive epibulbar squamous carcinoma. Several other health systems and their doctors are at different stages of onboarding LV technology. In the USA, this requires adding the LV source to their radiation license. Specialized health system, radiation safety, and physician accreditation educational modules are needed. However, no IRB or ethics committee approvals are required for commercially available devices. I have been asked about the interaction between radiation oncology, medical physics, and the operating surgeon. This diagram depicts what happens in the operating room. The LV-Y90 disc calibration can be rechecked in the hospital's laboratory by medical physics. Then the disc is sterilized in an autoclave and brought to the operating room. Behind a plastic L-block shield, radiation oncology or medical physics affixes the disc into a factory sterilized applicator. When the radiation field is marked or checked on the patient, the radiation oncologist brings the completed I-wand system shielded by water within a 2-cup pitcher onto the Mayo stand. With the targeted zone defined by the surgeon, who places the I-wand into position for the prescribed number of minutes or seconds, then the surgeon places the I-wand back into the pitcher of water on the Mayo stand to be removed for disposal by radiation oncology. As you see in this diagram, all the non-ophthalmic aspects are completely controlled by radiation oncology and medical physics. I would like to take this moment to thank you for your attention. Liberty Vision has links to many and can share any open access reprints describing prior work. In the meantime, LV invites you to visit our website, libertyvision.com. Thank you and have a wonderful day.
Thank you, Prof, for your excellent talk. Very interesting, actually. Can I ask you, first of all, when do you think that this new device can be available in Europe?
Well, as soon as possible. The CE mark has become more difficult to obtain, but all the pieces are in place for a collaboration with a large company or to start from scratch. Can you hear me?
Yes, 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 because it looks very interesting, and we'll be happy to know when it will be available in Europe. And
Yeah, it's a wonderful tool to
yeah,
prevent and treat neovascularization, which, as you know, is very common in ophthalmology. There are
yeah,
so many
exactly.
disease states that involve
Yeah.
abnormal blood vessels growing where they're not supposed to.
And now comes my second question. Do you have been any radiation effects from the treatment?
Well, the normal radiation so far it's been short follow up, but the
Mhm.
normal radiation effects that you might expect, like
Okay.
tumors dissolving away or getting smaller. But
Mhm.
interestingly, having practiced ophthalmic oncology for nearly over 35 years, uh, I can tell you that one simple surgery is much less traumatic for the patient, and they don't have. It's wonderful to see them not having to go home with a radioactive device sewn
Yeah.
to their eye, and so it's just much easier for the patients.
What about the local control?
Local control has been excellent, but as local control is usually measured in years and not in months.
Mhm.
So we're still waiting for more long-term follow-up.
Okay. So I know that you are very busy today, so I don't want to keep you further. Thank you so much for your live presence in this episode. I hope to see you very soon.
Thank
And
you so, Dr. Fafinaki. I want to thank you for inviting me. It's an honor to be with you, and I wish you the great success with your center in Greece.
thank you so much. Thank you so much. Thank you very much. Thank you.